This is the final self-care video in the LIT Health and Wellbeing series. Today I'm going to show you how to do Thermal Auricular Therapy, otherwise known as Hopi Ear Candles. Okay, so I'm going to start off by lighting the candle. So obviously, because you're working with a naked flame, you need to be careful. You can see that I have the head covered with a towel. I'm just going to insert the candle into the ear. So nice and gently. You're not pushing it in, you're not putting any pressure on it. And then, as you can see, I'm crossing my hands over just to protect the ear as well. So the candle is going to burn down. Normally it takes between maybe 10 to 12 minutes. And these candles aren't like regular candles, so they're hollow on the inside. And once the candle is lit, what happens is the air starts to circulate within the candle and it creates a suction. And this suction is very good for loosening compacted earwax. It's very, very good for sinus congestion, to drain and clear the sinuses. The treatment can be complemented with a massage once you have both ears done. And this is very good for somebody that suffers with headaches and to relieve pressure. So as you can see, you just have to be very careful. It is a very relaxing and very beneficial treatment. You have to take some precautions when you're using the candles, so they're not suited to everybody. In the candle box, there is little step-by-step instructions, and it will tell you who you can and cannot use it on. So you can't use the candles on anybody that has any ear issues. For instance, perforated eardrum, cochlear implant, or any kind of ear disorders, they're not suitable. But overall, a very relaxing treatment. Great to clear the mind. So once the candle burns down to the red safety line, very gently take the candle out of the ear, and you're going to extinguish it in a little glass of water. So that's one ear done, and we move on to the next ear. So now we're going to move on to the second ear. So I'm going to light the other candle. I'm going to place it gently into the ear. And let that burn down. So you can buy the candles in any health food shop. And also, to complement the treatment, I'm going to show you how to do some drainage movements and some specific pressure points that would help if somebody is suffering with congestion in the head, sinus congestion, or headaches. So the candle has burnt down to the safety line. So very gently, I'm going to remove it from the ear. Again, I'm going to extinguish it into the water. And now, to complement the treatment, I'm going to show you some acupressure and drainage movements. So I'm going to show you some pressure point movements, and then I'm going to show you some drainage movements, which are going to help with sinus congestion. So the frontal sinuses on the forehead, the ethmoid sinuses underneath the eyes, and the maxillary sinuses just underneath the cheekbones. So we're starting off with our pressure points. So we're going to do like a pumping action just on the crown. Then we're going to move down. We're just going to do a little circle in the center of the forehead. in between the eyebrows. The center of the eyebrows. And sliding down to the tail of the eyebrows. Into the tear duct. And sliding out towards the temples. Sides of the nose. Corner of the mouth. And the chin. So you can do that routine 3 times. And then we're just going to do some drainage movements. So we're just going to drain out the forehead. So again, this is going to help relieve any pressure. And relieve stress on the cranial nerves. And it also complements the treatment very well, as it's helping to drain the sinuses. Then we're moving down and we're draining underneath the eyes. And then we're moving down slightly and we're draining just underneath the cheekbones. So again, you can do these draining movements, about 30 seconds each move. And you can do the routine 3 times. That's a wrap from the team and I. Hope you enjoyed the LIT Health and Wellbeing series. Thank you for joining us.